Today we are going to learn about childhood reflexes. We're going to talk about what the importance of them, and then we're going to look at some questions also. So let's go ahead. So this is a clinical guide which talks about primitive reflexes, which are born, which are present at birth, and then postural reflexes, which are present a little bit later. So you want to understand why you need to know about these reflexes. When a child is born and they're developing, you want to understand and have an idea about their nervous system development. To understand the nervous system development, the reflexes help. The three things you want to know about the reflexes is you want to know some main reflexes which the exam is going to ask. Then you want to know how to elicit a response or the reflex. What would be a normal reflex response? And then you also want to know when it disappears. So let's look at it. So what are these reflexes? These are automatic movements triggered by specific stimuli essential for early development and neurological assessment. Means like when you elicit it, you know that this is what is going on, normal, what is normal. Now, most of them disappear in the first 3 to 12 months of life as the nervous system matures, which is a good thing. You want them to be present at birth and then the primitive ones to disappear, which shows that the nervous system is maturing. Now, what is the clinical significance? Persistent primitive reflexes may indicate developmental delay or neurological dysfunction. What it means is that when you are eliciting a response or a reflex, if let's say that one reflex has to be disappearing at 3 months, but it's not disappeared until 6 months or it's still present, then there is a developmental delay or you want to consider neurological dysfunction. Now, you want to differentiate between primitive versus postural reflexes. Primitive reflexes are present at birth. These postural are developing over the first months. The peak timing is 0 to 3 months and the postural is 2 to 12 months. And the primitive ones, most of them disappear between 6 to 12 months and the postural ones disappear 12 to 36 months. What is the function of the primitive reflexes? It's mainly of survival and feeding because it's more of sucking, uh, grasping, and things like that. The postural reflexes are balance, coordination, and posture. Examples of primitive reflexes are Morrow's reflex, rooting reflex, and sucking reflex. And the postural reflexes are righting and equilibrium. Okay. Now let's go. Like think about a mnemonic, Mrs. GMT. This will give you the 6 critical primitive reflexes. Morrow's reflex is uh, some Morrow's reflex is um, startle reflex, and R is for rooting reflex. S is for sucking or oral feeding reflex. G is for grasping, which is palmar and plantar. M is for marching, which is stepping reflex, and T is for tonic neck fencing position. Now let's look at Morrow's and rooting reflexes. Morrow's reflex is mama's overreaction response. The trigger is sudden loss of support, loud noise, or head drop. Response is arm abduction and then adduction and leg extension. Timeline, birth disappears 3 to 4 months. So Morrow's reflex is when there is a sudden loss of support or loud noise, there is startle, like the baby freaks out and the arms move and then they're like close together and it disappears 3 to 4 months. If there is a asymmetry in this, means like it's different presentation, then you think about brachial plexic injury or hemiparesis, means like one side appears to be not so normal, then it is you want to think about brachial. In the exam, you want to think if they give a child who is presenting with brachial plexus, you want to think about startle. They can ask this way or that way. Okay, now The next one is rooting reflex. When you stroke a cheek or a perioral area, the head turns towards the stimulus, mouth open, searching for food. The timeline, it appears at birth and disappears 3 to 4 months. Let's say that absent rooting reflex is CNS depression and weak sucking response, that is muscle weakness. Okay. Now, the next one we have is sucking reflex, which is if you place an object in the mouth, spontaneous sucking motion comes. This is present at birth and disappears 4 to 6 months. A weak sucking with hypotonia is prematurity, okay, or a neurological issue. Now, grasping reflex, if you give a finger or something, they grab and squeeze. So if you stroke the palm, fingers flex, curls around the object strong enough to support infant's weight. Plantar is lateral sole, toes curl downward. So you'll see, like if you stroke the hand, they'll fold like that. The same thing for the uh, bottom of the feet also, that's the plantar one. Okay, the timeline is palmar disappears 5 to 6 months, plantar disappears 9 to 12 months. Again, asymmetric grasp is spasticity or weakness you want to consider. Okay, now stepping or ANTR reflex. Stepping reflex is like a marching reflex. To remember this, moving around with rhythmic coordinated hip gait. Okay, hold the infant upright, feet touching surface, lean forward, and they will show an alternate stepping motion. It is present at birth and it disappears 2 to 3 months and reappears as voluntary walking at 9 to 12 months. If it is absent, it's hypotonia. If it's asymmetric, means left and right are different, then you can think about hemiparesis, which is rare. Now, ANTR reflex, you can think about arms, trunk, neck reflex. It turn the infant's head to one side, the same side arm and leg extend, and the other side arm flexes. It's present at birth, peaks at 2 months, and disappears 5 to 6 months. Now, this one is tested a lot, so you want to think about this. If it is present past 6 months, that means that the child may have cerebral palsy. Okay, ATNR reflex. Now, postural reflexes are writing and equilibrium reflexes develop later and persist into adulthood. So they appear 2 to 3 months and persist into childhood. Okay, sometimes adulthood, sometimes. Equilibrium is when you're in equal weight, limb positioning. They will have a parachute response. It appears again not at birth, 4 to 6 months, and then if it absent at 12 months, then you want to think about concern of neurological. So postural reflexes are not present at birth, they come later. Now, so you want to think about reflex development time. So at birth, you have the Morose reflex, rooting reflex, sucking reflex, grasp reflex, stepping, ANTR. So these are all the primitive reflexes. At 1 to 2 months, ANTR strengthens, writing reflex appears. This is a postural reflex. Now 3 to 4 months, Morose and rooting begins to disappear. Parachute begins developing. This is again a postural. Okay. 4 to 6 months, grasping, the palmar, plantar, they weaken. Equilibrium, which is a postural, that comes in play here. Now, 6 to 8 months, parachute reflex is complete. 9 to 12 months, plantar reflex fades, stepping returns, and then 12 months, most primitive reflexes are gone, but postural reflexes are present. Okay, now let's go. So again, looking at in a different way, you want to have this, review this chart, and most of the questions asked possibly can be answered by just mastering this chart. I recommend you viewing this couple of times. So, and it will help you about if there is a problem, what do you need? For example, ATNR, if it is persistent, then you think about cerebral palsy, okay, and other things. Hope that you can view this. Now, so clinical pearls when primitive reflexes are persistent or present beyond certain time period, it is pathological. So ANTR past 6 months, strong predictor of cerebral palsy. Morose reflex after 5 months, considered brachial plexy or birth trauma. Absent Moro or grasp, prematurity, sepsis, maternal substance abuse, or asphyxia. Absent parachute at 12 months, development delay or neurological dysfunction. Asymmetric response means like right and left are different. Then you think about stroke, injury, focal weakness. Okay. Quick assessment. Assess both sides. Always test bilaterally. Any asymmetry is abnormal. Timing matter. Test reflexes before baby is fussy. Usually distal stimulus first for best results, means legs first before arms. And then palmar grasp is strong enough to support an infant's weight. Okay. That now let's see. Okay, let's look at some clinical scenarios. On routine exam, turning the infant's head to the right causes the right arm and leg to extend while left arm and leg. What is this? This is asymmetric tonic no reflex, the classic fencing position. It's present at birth, peaks at around 12 months. Is it normal at 6 months? It should disappear at 6 months, and we talked about cerebral palsy as the reason for persistence. Okay, so asymmetric tonic clonic neck reflex would be one thing which would be tested on the exam most often. Okay, now again, this is a different way of looking at it. Persistent ATNR is cerebral palsy. Absent parachute is development delay. Palmar grasp and strong enough to support infant's weight. Asymmetric Moro is brachial plexus paralysis. Weak sucking reflex and hypotomia is due to sepsis or prematurity. Postural reflexes sometimes persist into adulthood. Okay, now you want to think about this key summary is that the mnemonic helps you remember all the primitive reflexes. Persistence is pathology. Asymmetry is always abnormal. Top red flags. Okay. Okay. Now let's do this self-assessment. Okay. A 2-month infant is brought to the clinic for routine well-child visit. On neurological examination, the examiner turns the head to the right and right arm extends while the left arm flexes. This reflex pattern is called which of the following? Morose, rooting, asymmetric, stepping, grasp. We talked about this. The answer is C, asymmetric. Think about cerebral palsy. 9-month-old boy is evaluated for developmental concerns. On examination, ATR is still prominently elicited on both sides. Which of the following is most likely diagnosis? Cerebral palsy, hypotonia, spina bifida, prematurity, normal variant. The answer should be cerebral palsy beyond 6 months. A 3-year-old newborn is examined in the nursery. The examiner gently touches the area lateral to the infant's mouth and the head turns towards the stimulus of the mouth opening. What is the name of this reflex? So, rooting reflex is elicited by stroking the perioral area, cheek. My recommendation would be, after you look at this one, if you YouTube search for reflexes, there are some good videos which show you videos of the reflexes, and so that you can see the videos also. The newborn is dropped approximately 6 inches onto a padded surface during examination. Infant suddenly adducts both arms followed by adduction in the embrace position and extends the legs and crying. What reflex is this? More stepping. I think maybe stepping. Oh, sorry, Morris reflex. So Morris reflex is triggered by sudden loss of support. Okay. Okay. So let's redo this. Newborn is dropped approximately 6 inches into a padded surface. The infant suddenly adducts the both arms, and when is their embrace position, think about Morris reflex and extends. So that's what I would remember. And also, one of the remembering point is if there is abduction of arms and adduction, then think about Morrow's reflex also. An examiner places her finger in the mouth of 1 week old and the infant begins to suck rhythmically. This reflex will typically disappears by which age? I think about this 3 to 4 months maybe, or 4 to 6 months. So sucking reflex appears at birth and typically disappears 4 to 6 months. Let's remember that. A 5-month-old infant is brought in for an evaluation for poor feeding. When the examiner places the finger in the infant's mouth, no sucking response is elicited. Infant is also has decreased muscle tone throughout. Which of the following is the most likely diagnosis? Poor feeding, normal development, prematurity, cerebral palsy. I think decreased muscle tone tells me hypotonia, so I'm going to go by B. Okay, prematurity with hypotonia. Okay, anytime you hear muscle strength is weak, you can look for hypotonia. When an examiner strokes the lateral sole of the newborn, the infant toes curl inward. That is plantar. Anytime foot, think about plantar. Okay, plantar. Okay. Mother brings her 1 month old infant to the clinic and reports she can barely hold the baby in her arms because the grip is so strong. When the examiner places a finger in the infant, grasp it firmly. Which of the following best describe? Okay, the grasp reflex is strong enough to support the infant's weight. It's 1 month old, it's grasp reflex. So I think answer is A, I would go. Okay, answer is A. Okay. It disappears, palmar reflex disappears at 5 to 6 months. Now the question 9, 6-month-old boy is brought to the emergency room department after a fall from a changing table. On neurological examination, there is an absence of Morrow's reflex on the right side only. The left Morrow reflex is normal. Which of the following is most likely diagnosis? Six-month-old on your absence of Morrow's reflex on the right side. Left is normal. So there is asymmetry. Whenever asymmetry comes, it's not normal. It could be brachial plexus injury on the right side. B. Okay, B. Okay. During a routine newborn exam, examiner places the baby upright with the teeth touching the bed and leans the infant forward. The infant begins to take alternate stepping motions as he's walking. This is stepping reflex because stepping motions as in walking. Okay, stepping marching reflex. Okay. A 2-month-old premature infant born at 32 weeks, now 6 weeks is examined. The stepping reflex is diminished bilaterally. The mother is concerned about development. Which of the following is the most appropriate? 2-month premature stepping reflex is diminished. It's abnormal, indicates cerebral palsy, expected immediate. 2-month premature. I have to look at the answer. This is expected. So remember to use corrected age, gestational age. So the patient is premature is up to 12 months. At 6 weeks corrected age, this should be diminishing and disappearing. Okay. So you want to like this, because this is premature, you want to correct the age. And at 6 weeks corrected age, the stepping reflexes should be diminished. A 1 week infant is examined and demonstrate normal sucking, rooting, and primary reflex. All responses are bilateral and symmetric. Which of the following is appropriate assessment? So let's look at it. A 1 week infant is examined and demonstrates normal. All responses which are okay, all are normal. All normal, infant is, I think C is the answer. Okay, neurological, because all are normal and at birth. A 4-month infant is examined. Examiner drops the baby face down and padded mattress. Infant extends outwards as it breaks. What reflex is it? This is parachute reflex because they're falling and they're extending themselves. I think it's parachute. Yeah. It appears at 6 to 8 months. Absence of reflex is this is a critical milestone, so you want to remember that. 1 month old baby is examined. When the infant's head is turned to one side in the supine position, examiner notes that the arm on the side extends while the opposite flexes. Okay, 1 month old when turned, examined. So this should be 4 to 5 months. Okay, 5 to 80 an hour. Is present, peaks at 2 months and disappears at 5 to 6 months. Okay, so let's read this again. 1 month old, when your head is turned once to one side, the examiner notes arm extends and the opposite flexes. This is ATNR, so disappears at 5 to 6 months. It should, if it continues, then it's cerebral palsy. 3-month-old newborn in nursery has a right Morose reflex. This is weak and incomplete compared to the left side. The examiner also notes the right arm hangs limp. Which of the following is the most likely diagnosis? Right brachial plexy? Yeah, because one side is different than the other. So I'll stop here. I hope take time to review the YouTube video. If you search reflexes, childhood reflexes, you'll see a video from some nursing group which have done a great job of eliciting the reflexes. First view that video because you will have an idea of like how what are the reflexes and how to elicit them. Once you watch the video, then watch this one again so that you can review. The main important thing is that if you look at the chart, many like there are only few ones which are tested, like ATNR, Morose, parachute. Know the date of appearance and disappearance. Okay, thank you.